Today I'm going to discuss about a very important and most important GI triad that you must encounter in your USMLE MBBS exam. So let's start. So our first triad is a Charcot triad. So Charcot triad is basic is a fever, jaundice, right upper quadrant pain. So it is a basically due to the infection, due to the obstruction of the biliary tract. So the labs will increase breath bilirubin and increase ALP. Increase ALP. ALP shows the biliary obstruction, right? So it is an infection. So treatment is antibiotic. So we give antibiotic, right? So what is a Reynolds Pentad? So it's a basically Charcot triad. So Charcot triad plus hypotension and altered mental state. So regular triads. So regular triad. So what is a regular triad? So regular triad is basically the pneumonia, air in the biliary tract, small bowel obstruction, and ectopic gallstone. So gallstone, the most common location is a terminal ileum. So why it is a terminal ileum? Because it is the narrowest portion of the GI tract. Provisor law. So provisor laws say that TNS jaundice plus palpable non-tender gallbladder and the history of the weight loss. So it is typically present in the pancreatic head tumor. So that's why the weight loss is present in the provisor law. So Whipple striate. So what is a Whipple striate? So Whipple striate is typically present in the insulinoma, that is the insulin secreting tumor. So the hypoglycic symptom that release after the glucose intake and the low plasma glucose. So this typically triad present in the insulinoma. So Plummer Vinson syndrome, another high yield triad you must encounter in your exam. So it is a dysphagia, iron deficiency, anemia, and esophageal webs. Peptic ulcer complication. Many questions you found in your USMLE and MBBS exam related to the peptic ulcer complication and particularly the perforation, that is an emergency. So it typically presents sudden severe abdominal pain, rebound, tenderness, and air under the diaphragm on the X-ray. So typically you found the X-ray of this peptic ulcer complication, perforation. Melrivas syndrome. So Melrivas syndrome is basically the hemochromatosis, retching, and alcohol use. Boerhaave syndrome. So basically, the Boerhaave syndrome is basically the severe chest pain, subcutaneous emphysema, and vomiting. Pets-Jaeger syndrome. So the Pets-Jaeger syndrome, you found hemochromatosis polyps, pigmentation, and increased risk of the cancer. Zollinger Ellison syndrome. The key thing, peptic ulcer, that is a distal to the duodenum. That is the most high yield key point. It suggests that uh, the ulcer is distal to the duodenum, that excessive acid secretion and that inactivate the pancreas enzyme and it will lead to the diarrhea, and ultimately steatorrhea. Why steatorrhea malabsorption? Because inactivation of the pancreatic enzyme due to the increased pH, due to the decreased pH because increased gastrin, increased acid, so decreased pH. So pancreatic enzyme didn't found the optimum pH, and it will lead to the diarrhea, ulcer distal to the duodenum, and gastrinoma. So it is a gastrinoma basically. So gastrin secreting tumor, and the common location is pancreas. Familial adenomatous polyposis. So that is again the super high yield. So why it is a high yield? Because it's 100% progress to the colorectal cancer. That's why the prophylactic colectomy is a treatment. So it is autosomal dominant mutation of APC tumor suppressor gene, and thousands of the polyps arises starting after the puberty. So Garden syndrome, FAP, we already discussed about the FAP, osteoma, that is a bone tumor, and soft tissue tumor. So Charcot syndrome, Charcot is FAP or Lynch syndromes, brain tumors, and CNS symptoms. Due to the brain tumor, it typically present with CNS symptoms. So the Charcot syndrome, carcinoid syndrome, they typically present with the flushing, diarrhea, and Wright's heart disease, right-sided valvular involvement. So Wilson disease is basically accumulation of copper in the liver. So accumulation of copper, and it typically present liver disease less than 48. That is a very important, less than 48 of age. Psychiatric manifestation, neurological manifestation due to the accumulation of copper. So hemochromatosis is typically present cirrhosis after 40. So after 40, hemochromatosis is less than 40, liver disease, it is a Wilson disease. So diabetes and skin pigmentation. This is a typical triad of the hemochromatosis. Hepatorenal syndrome, it typically cirrhosis, decreased GFR, and renal vasoconstriction. Celiac disease. Celiac disease, it is an autoimmune disease that typically present with the chronic diarrhea, weight loss due to the diarrhea, and nutrient deficiency or malabsorption. So what happened is basically the autoimmune disorder damage the villi, and when the villi is damaged, the body is unable to absorb the essential nutrients. And that's why the nutrient deficiency, malabsorption, diarrhea, weight loss. That is a very, very important. Crigler-Najjar syndrome. So it is a basically due to the absence of UDP glucuronide transferase enzyme that lead to the conjugation of unconjugated bilirubin. So if the conjugation does not take place, it will lead to the unconjugated bilirubin, increase in conjugated bilirubin in the blood. So it typically presents with the neonatal jaundice. So it is a hereditary hyperbilirubinemia. So it is a severe form. So what is a less severe form? That is a Gilbert syndrome. So Gilbert syndrome also problem with the UDP glucuronide transferase enzyme. So that is a less severe form. This is the most severe form, the Crigler-Najjar syndrome. So both present with increased unconjugated bilirubin. Why unconjugated increased bilirubin? Because the absence of UDP glucoside transferase enzyme that involved in the conjugation. Refeeding syndrome. So refeeding syndrome, what happened when the severely malnourished, so malnourished patient sudden increase in calorie. Sudden increase in a calorie intake of this malnourished patient, it will lead to increase insulin. This increased insulin will lead to increase uptake of self, increase uptakes of hypophosphatemia, increase uptake of the phosphate, potassium, and magnesium by the cell. So the plasma has a less amount of these things and they are deficient in the blood. So it's typically present with the emergency due to the cardiac problem due to the hypokalemia.